If you examine some kids, they have a high arch palate.
Mm-hmm.
Is there any significance to a high arch palate?
Yeah, high arch palate sometimes is associated with a cleft palate, and you can have associated.
Wait a minute, it's intact high arch palate. Is there a certain type of cleft you're talking about?
There's a type of cleft called the submucous cleft, which is a cleft palate that a cleft palate is when you have an actual malformation of the palatal clefts that come together, and they don't actually meet. A submucous cleft, which is what we're describing here, is actually an association of the palate that doesn't completely come together, but is lined usually with a layer of mucosa or skin in the inside lining of the mouth.
It's a poorly built structure.
Exactly.
If someone was going to have a tonsillectomy surgery
Sure.
and an high arch palate, that's one thing you'd be careful to exclude from the diagnosis.
Exactly.
Be a problem.
Yeah, there's something that we look for prior to doing tonsillectomy, because it can be associated with post-operative tonsillectomy issues and adenoid issues. If you're removing the adenoids, for instance, and you have a high arched palate or submucous cleft, I should say, then you open yourself up to something called velopharyngeal insufficiency, which is escape of the contents from the mouth into the nose. It has a higher incidence of that.